Welcome to Module 5, Nursing Informatics Pioneers in Practice and Industry. My name is Bonnie Westra, and I'm an Associate Professor Emerita and Co-Director for the Center for Nursing Informatics here at the University of Minnesota School of Nursing. In this final presentation for this course, we will examine the histories of nursing informatics pioneers in practice and industry. As with the pioneers we've studied previously, their attitudes, advice, and strategies can be compared to those that we see today in our interviews and in our own workplace. The pioneers in nursing informatics began their careers in clinical settings as staff nurses, clinical nurse specialists, or managers. Many of these were in hierarchy cultures. Because they were agile and had visionary ideas, they took on key leadership roles in market and creative cultures. So here are some examples. Dr. Patricia Button was the Clinical Nursing Officer, or CNO, for Zincs Health, where she was responsible for Zincs Care, which is a product that provides customizable, evidence-based practice for interdisciplinary plans of care. She has a depth of knowledge about the critical success factors of effective systems development and implementation, experience in managing large, complex projects, and use of process and workflow analysis as the basis for the development of effective implementation and support programs. Rosemary Kennedy was the Chief Nursing Informatics Officer, or CNIO, for Siemens Medical Solutions. In this role, she provided professional practice leadership for the development and deployment of solutions to ensure that nursing practice and interdisciplinary requirements were met. Deborah Konasek was Managing Director for the College of American Pathologists, Professional Services Division, where she was responsible for the development, sales, and delivery of consulting services related to health information management, technology, and terminology. Deborah, a senior healthcare consultant with more than 30 years of clinical and electronic health record implementation experience, led the team responsible for assisting with the global implementation of terminology standards for organizations worldwide. Karen Martin was a healthcare consultant with the Omaha System Terminology. She provided many seminars and consultations about the usefulness of the Omaha system for documenting nursing and interprofessional care, particularly in community-based practice settings. Judy Murphy was the first Chief Nursing Officer as well as the Deputy National Coordinator for Programs and Policy at the Office of the National Coordinator for Health IT in Washington, D.C. Previously, she was Vice President of Electronic Health Systems at Aurora Healthcare in Milwaukee, Wisconsin, which is an integrated delivery network with 15 hospitals and 30,000 employees. Joyce Sensmeyer was the HIMSS Vice President of Informatics and responsible for areas of clinical informatics, standards, interoperability, and privacy and security. She was one of the founders for the Alliance for Nursing Informatics, which is an organization of nursing informatics organizations to advance informatics practice, education, policy, research, and leadership with a unified voice for nursing informatics organizations. Roy Simpson was the Vice President of Nursing Informatics at Cerner Corporation, which is one of the largest electronic health record vendors internationally. He was responsible for strategic sales and planning for patient care enterprise and industry relationships related to professional nursing practice. Charlotte Weaver was the Senior Vice President and Chief Clinical Officer for Gentiva Health Services out of Atlanta, Georgia. Formerly, she held the positions at Cerner Corporation that Roy Simpson subsequently followed in. Since 1981, she has covered the industry, software supplier, consultant, and provider in the US, Canada, and Australia. In the next couple of slides, you will see examples of attitudes, advice, and strategies that help them achieve these leadership roles. So several attitudes which influenced the behavior of pioneers were noted across the interviews. Roy Simpson commented that one way of building self-confidence or assurance is through checking out ideas through your network, as in a collaborative culture. They can help you get a sanity check about whether your ideas make a difference, not only in your organization, but for others as well. Being in industry requires a spirit of entrepreneurship, as in a creative culture. It's a chance to see opportunities and then to go for them, as in a creative culture and as in a market culture. That requires having a vision of what's possible and then continuously taking action towards that vision. Across all cultures, it's important to enjoy and share enthusiasm for the change. Karen Martin said that it's really important to enjoy the work that you're doing, and without that enjoyment, work is just not as satisfying. Deborah Konasek commented that she was very enthusiastic about terminology, and the enthusiasm is what really made a difference for her. So across all cultures, you will see the themes of enjoyment and enthusiasm. So one pioneer advised leaders in informatics to remember nursing brings an essential perspective. We work in a variety of settings, and our professional knowledge and skills are central to the healthcare success, as in a creative culture. While it's important to realize that nursing brings much to the table, no profession can work in isolation. Nursing and interprofessional practice are really important, as in a collaborative culture. Having mentors was important advice for a number of the pioneers. In fact, one recommended having 2 mentors, one that's inside your organization and one that's outside the organization. The value of an outside mentor is to gain perspective, a different point of view, as in a collaborative culture. So many of the pioneers advised to become involved in organizations and expand your network. The value of networking is not only to expand who you know, but also to get broader exposure to knowledge from other people and to validate the success of what it is you can accomplish as in a collaborative culture. So there are some differences in how informatics might be described in industry as in a marketing culture compared with academia in a hierarchical culture. One of the points that Roy Simpson made is that in industry, it's important to know what the terms mean. So you'll find some terms that are synonymous but not the same in academia as in marketing. So for instance, you'll hear market or product analysis or focus groups, which are research skills, but they would never be called research in the market environment. So skills from both cultures will be important, but pay attention to what is meant by the terms. So a couple of interesting strategies were noted by the pioneers for moving forward and overcoming resistance to change. In a collaborative culture, good communication skills are essential. Giving credit to people for the work that they're doing, acknowledging that they make a difference, fosters collaboration. Appreciation and inclusion is a means to fostering high commitment, as well as recognizing achievement. Judy Murphy talked extensively about the importance of instilling ownership by the Department of Nursing, such as the implementation of using an electronic health record. In particular, she noted that you might work with nursing leaders to have sufficient knowledge about the systems so that they have a sense of ownership and leaders for change throughout informatics. Often in nursing, we are cautious not to make mistakes, as they could harm patients. But Rosemary Kennedy commented that in informatics, it's so new yet that it's better to keep moving and not get hung up on making everything perfect before you try on the next thing that needs to be done. Being perfect is the enemy of good and making progress. This is consistent with a creative culture in which we constantly design, revise, and change based on experience, as well as in a market culture in which we must move rapidly and aggressively. Joyce Sensmeyer specifically said that the key to leadership is making sure that you have good communication as well as good organizational skills, which are important in a hierarchical culture. Often we feel that there are barriers and limitations to achieving goals, and Karen Martin noted that limitations are just part of life. It's important to understand how big they are and how to move beyond them, and then just keep going. This is consistent with understanding that capable processes produce effectiveness, as in a hierarchy culture. A marketing culture also indicates recognition of contributions of others and giving them credit for what they do. So the pioneers in practice and industry continuously focused on the value of informatics and what it's really all about. Leadership in informatics requires that we work together with standards organizations and vendors who create products to support practice. If these products are designed well, then we can make nursing practice better, and the result is to improve the health of populations. This module concludes the course on Nursing Informatics Leaders. In this course, we looked at exploring the AMIA Nursing Informatics History website. We then selected insights, advice, lessons learned, and strategies that were used by the pioneers in nursing informatics to develop the specialty in response to the rapid evolution of technology. Specifically, we looked at the importance of organizations and networks for the pioneers. We then looked more specifically at the evolving leadership in research and academic settings, as well as the advice from pioneers in practice and industry. Through interviewing someone who is running as a nurse informatics leader or in a similar role, you have gained additional advice and lessons learned and how those apply to your leadership knowledge and skills. Now it's your turn to synthesize historical perspectives across the many pioneers and compare them with your experience in nursing informatics today. I hope you've enjoyed the learning about these pioneers and their leadership experiences as the nursing informatics specialty developed, grew, and changed in response to technology in healthcare. I am delighted to have the opportunity to share with you the stories, and I encourage you to continue to document the histories of nursing informatics going forward. In the next course, we will consider the future of nursing informatics. Just as in the past, we will continue to see massive changes in healthcare due to technology. There is a critical need for visionary nursing informatics leaders who are prepared and can continue to lead in order to manage and support these changes for the good of patients and healthcare.